Flannery to make your presentation. Right, we'll resume, and I call on Dr. Flannery now to make his presentation.
Yeah, welcome back. I'm the chair of the Faculty of Addiction Psychiatry of the College of Psychiatrists of Ireland, and we in the College have repeatedly called for the use of evidence-based measures to reduce alcohol-related harm. There are many such measures: pricing, availability, enforcing of drink driving, effective treatment, reducing availability, and obviously why we're here today, banning the promotion of alcohol. In 2008, the college issued a policy paper calling for a ban on all alcohol advertising and sponsorship. We did this as we were concerned particularly about the evidence of adolescent alcohol-related harm. And since then, what is worrying is that there has been additional national and international research outlining the extent of alcohol advertising targeted at adolescents. For example, the British Medical Association, which advocates for the health of the public, has examined the damaging effect of alcohol marketing in young people. They said that alcohol marketing has a powerful effect in young people and is independently linked with the onset, amount, and continuation of their drinking. Through the use of TV, social networking, sponsorship of music and sporting events, they reinforce and exaggerate strong pro-alcohol social norms. They gave a number of recommendations, but their first recommendation was to ban all alcohol marketing. The science group of the European Alcohol and Health Forum found consistent evidence to demonstrate an impact of alcohol advertising on the uptake of drinking among non-drinking young people, and increased drinking among existing drinkers. A survey in New Zealand found that sports people receiving direct alcohol industry sponsorship reported more hazardous drinking than those not receiving sponsorship. And finally, for the evidence, the WHO has stressed the critical importance of delaying the onset of drinking in young people. Suicide is the leading cause of death amongst 15 to 24-year-olds in Ireland, and we have the fourth highest rate of youth suicide in the EU. Research from the National Suicide Research Foundation 2 years ago found that alcohol was involved in 24% of all cases of deliberate self-harm, that is attempted suicide, which rose to 44% for male cases. The association between alcohol and attempted suicide appears self-evident given the timing of peak presentation to emergency departments around midnight on Sundays, Mondays, and increasingly on or after public holidays. More research from the National Suicide Research Foundation shows that suicides among men rose sharply as the economy went into recession, with higher rates for those in the construction industry and having a harmful drinking pattern. Given these facts, I find it myself disappointed at the drinks industry behaviour towards the National Substance Misuse Strategy Steering Group. The aim of this group was to develop an alcohol strategy to run alongside the National Drug Strategy. The college, the drinks industry, and many other representatives from other areas of health, community and government were there. The college believed that all present were acting in good faith and over 2.5 years worked to reach a consensus. The group issued their report just over a year ago. Despite being in the group, the drinks industry chose to stand aside and issue a minority report. At a personal level, I've been working in psychiatry now for about 15 years. One of my first training positions was in child psychiatry, where each morning the patients greeted me with "What's up?" At that time, it was a slogan for Budweiser. These patients were children, the majority under the age of 12. It is these children who picked up on this ad who are now adults and are making headlines about being drunk in Australia. I now run an addiction service in the Midlands, and most of my patients are dependent on alcohol, that is, alcoholics. As anyone who knows an alcoholic will recognise, denial is a strong feature of the illness. They are convinced they need alcohol to be normal, to be happy, to function. I hear the same language from those who have alcohol sponsors. Without alcohol, our sports, music or culture events will not happen. We need alcohol sponsorship to have major tournaments, run organisation. Alcohol is our culture. Denial is very powerful. Sadly, with some of my patients, my advice, that of their family, friends and work colleagues is ignored, and they continue drinking to their death. Since 1990, there have been 11 committees and 15 reports giving an advice on how to tackle alcohol-related harm. just as drink responsibly for an alcoholic does not work. I ask you to say stop to the drinks industry and call for a ban on all alcohol advertising and sponsorship in Ireland. Thank you.
Right.